tangential topic about blepharoplasty or nip tuck of the eyelids and how you can look more fresh and younger. This is a pretty detailed broadcast today where I'm going to go over the actual steps. So a lot of people have been asking how is it exactly done. So the most important thing when you're doing a blepharoplasty is to make sure it looks clean and nice and not like plastic surgery where things have been really pulled out and stretched. And that's why you have to mark out the anatomical features. And also the lid folds become very important, and the lid creases, because the incisions or the cuts should be made parallel to the lid creases that avoid scars. The first step we like to do is have the patient look in the mirror and ask them what they dislike about their lid margins or the skin of the lids. And then very carefully we make out marks to identify the loose skin so that we know how much to remove. You have to be very careful not to remove excess, because then that can prevent the lids from closing, something called like ophthalmos, which can lead to dry eye and exposure keratitis. That means when you're sleeping and dreaming, the corneas would get exposed, and then they would get dried out or desiccated, which can lead to even infections. And removing too little will make the patient a little unhappy and want to come back and ask for a little bit more fix. So it becomes very imperative that you act like an artist and have been observing lids of different people to understand what normal lid margin looks like. Once the marks have been made, we inject little local anesthetic under the marked area. Then we have two options after the lids have been prepped and cleaned. Either we can do with the plain old knife or use radiocautery to do a cut, which at the same time prevents bleeding. So we cut along the marked areas, and it's easier to go from the temporal side because you can enter the exact layer. And once you've found the correct layer, you can dissect it out, either again by using a blade, but preferably by reusing the cautery knife, because that prevents excessive bleeding. And then the tissue to be excised is removed, and then all the blood vessels are caught and cauterized, or that means the bleeding is stopped. Then a couple of stay sutures can be put to see the effect, and especially if both eyes are being done, which is usually the case, patient can be made to sit up and compare the two eyelids. So before the final stitching is done, both the eyelids should look symmetrical and similar. And then again, you have options of closing. Either you can do interrupted stitches or preferably continuous, which can be either subcuticular or through and through. The main thing is the scarring should not occur, and the stitches usually are therefore removed in 5 to 7 days. Tobradex or another combination of steroid antibiotic ointment is applied, and the patient goes home with instructions to put nice amount of ice to prevent swelling. Some discoloration from the blood oozing is common. One of the most important things to be kept in mind is if there is some excessive bleeding, it can track down behind the eye and affect vision. That's why it's very important that anybody who has this done should report any excessive swelling immediately to the surgeon. There have been cases where the eyes got swollen shut, and we have to do an emergency lateral canthotomy to relieve the pressure on the optic nerve, which saves the sight. So that surgeon should be around in case a call comes like this. And for that reason, it's imperative that all the bleeding should be stopped during the surgery, and that's the method which has been proven to be more effective. So if you have any more questions on this video, or you're considering blepharoplasty wherever you may be in the world, don't hesitate to ask me and post your question. Thank you for being with us today. Have a good day. Bye-bye.